Care in Canada Act, standing in the name of Ms. Gladue.
Reprise du débat, l'honorable député.
Resuming debate. The honourable member for Abitibi-Témiscamingue, who has 8 minutes left to complete her remarks. Well, thank you very much, Mr. Speaker. I didn't think I would have an opportunity to complete this speech, so I'm very pleased to have the 8 minutes remaining to do so. In the first part of my remarks, I had spoken to some points that perhaps the sponsor can come back to at committee, and I'd suggested including the First Nation governments in the consultation. I think that's one of the critical points. Oftentimes, a cultural approach to death isn't necessarily integrated, and the federal government has a duty to First Nations, and I think it's of the utmost importance for them to be sitting at the negotiation table to be able to talk about their needs. When it comes to palliative care, needs in Aboriginal communities, well, they're huge because to date there have been no projects along those lines. And in the past, it's been said that specific funds can't be earmarked for palliative care. Some First Nations communities don't have housing. They don't have long-term care facilities, so seniors, as a result, end up in the hospital through the provincial healthcare system, depending on the province that they're located in. And when, for example, there's a meeting of palliative care service providers, we see that they'd be interested in working on projects. I was in one such facility. They're located in Amos, which is very close to an Aboriginal community, and oftentimes they take in people from Pikogan, Aboriginal people, in need, and it's their pleasure to do so. And they say so. But it's not the same. The community is very different. The community is much more involved. People are there to support the person as they die. And she said they do their best in terms of needs and requirements, but clearly if there were an opening with respect to earmarked funding for First Nations for this area, they could have a room that would be adapted, decorated, tailored to their needs, that would reflect the approach, the client's approach. I think this will be something that will need to be discussed at committee. It will be important to discuss it at committee, and I invite my colleague, the sponsor, to think about that, to think about calling in witnesses from the Aboriginal community who might be interested in discussing this reality, to see how they could be involved in palliative care. Now, we're talking about the organization of care. This is a provincial jurisdiction, but the federal government does have a role to play when it comes to bringing the various players together to discuss practices. Now, we don't want to have a paternalistic approach where we tell everyone to simply look at best practices elsewhere. We want to look at the issues they've faced, successes, difficulties, to see how the care has developed. And there are certain aspects of palliative care that are often forgotten about. Palliative care at the pediatric level is something that's very difficult. How do you accompany a child that's dying from cancer, for example, or from another disease, a genetic disease? How do you help the child? I think it's important to discuss these issues and also to take a look at avoiding a situation where children who require palliative care have to choose between being home or near their homes or in a specialized care facility. That's often what happens. Many times they're hospitalized for long periods of time. They're far away from their communities and their living environments. Parents decide whether or not to bring the child back home into the community when they require palliative care. But that too is an issue when we talk about a specialized clientele. The clientele in the isolated regions often has trouble obtaining the care, how do we deal with those challenges? There are differences from one province to the next, different agencies involved, with the various tools that are required. So I think that if we were to look at all of that, we would come out ahead. There are other clients, for example, that are often neglected. What about someone, for example, with an intellectual deficiency? I've had to do that in the past, accompany someone. We don't necessarily always have the tools we need to do so, to work in a framework where the person understands death, the concept, understands what's happening, and when you step outside of that framework, then I think it's important to be able to take action. There are some deaths that affect us more than others as well. And so in palliative care, it's important to talk about distress among the care providers, regardless of where the person is working. There are some cases that are going to be very difficult, cause great sorrow. And I think that our approach to palliative care must take into account that aspect, must enable us to talk about it so that the care providers can avoid carrying these difficult times with them throughout their careers. Think for a few moments about soldiers who've been deployed abroad, who've had to be with someone as they died because they had no other choice. Sometimes those were very traumatic experiences for them. And after several years, it can be very difficult to cope with that. So that's another aspect that could be added to this bill on palliative care. Some kind of follow-up, public health follow-up, dealing with the problems facing the care providers. Working with death on a daily basis is not easy. And I think that it would be in our best interest to monitor the health conditions of the care providers, of people working in palliative care, especially in pediatrics departments, for example, where small babies we try to save them in neonatal critical care facilities, etc., where it's very difficult. And I think from a public health perspective, we need to monitor that situation. I'd like to thank my colleague for introducing this bill. I thank the House for this opportunity to speak, and I eagerly await any questions colleagues may have.
Honorable député de Montmagny-L'islay.
The honourable member for Montmagny, Islay, Kamouraska, Rivière-du-Loup. Well, thank you very much, Mr. Speaker.